Wow guys, first video of the last section of the course. I'm so excited. In this one we're going to be talking about your postpartum options. And I have them very thoroughly laid out below, so I don't want to go into too much detail and bog you down with all this stuff, but I just kind of want to gloss over them super fast. One of the things on the list is postpartum Pitocin. This is something that has gained in popularity recently to receive after the baby is born to help deliver the placenta. The thought behind this is that it reduces your risk of postpartum hemorrhage. It is relatively new, it's still gaining in popularity, so I would talk with your care provider on if it's right for you and what their hospital policies are surrounding it and stuff like that. Delayed cord clamping is pretty standard now, which is awesome. So for instance, if you want to wait until it turns white or until it stops pulsating, some people want to keep the placenta with the baby until it automatically dries and falls off, usually within the week or two after birth. Circumcision is another option that's still relatively common, and that is between you and your partner and what you think is best for your baby. The data is not solid on either way what is best, so look at the data and see what you think. You will also be offered eye ointment for your baby. And this is generally considered to protect your baby's eyes from any germs that it might encounter during birth. Some states have it a legal requirement to give your baby eye ointment. So I would suggest anything that you want to refuse for your baby's care, you talk with your care provider so that you know your legal rights and the hospital policies and anything you need to work around and with. Remember, if there's a hospital that doesn't meet all your needs, you can always find someone else. If there's a care provider that doesn't meet all your needs, you can always find someone else. Vitamin K is also something that is given to your infants, and interestingly enough, the cool thing about vitamin K is that it is low in the baby's body up to the 8th day, and on the 8th day, vitamin K reserves shoot up. And I've always thought that that's super interesting that the 8th day is when God told the Israelites in the Bible to circumcise their babies. And what does the vitamin K do? It prevents hemorrhaging. That can be an interesting thing for you to discuss with your providers about doing the circumcision on the 8th day instead of while you're still in your hospital stay. It is still uncertain why babies have low vitamin K for their first 8 days of life or 7 days of life. But that's something, again, that you need to discuss with your care provider on what you feel comfortable with. You will also be offered a hepatitis B injection, and whether or not you want to administer that vaccination during your hospital stay, delay it, or forego it altogether, again, it's just something you need to discuss with your provider on what you feel comfortable with. First bath is something that usually happens at the hospital, but honestly, you can wait as long as you want for that first bath. And in fact, the longer you wait, the more likely that your baby's going to develop good bacteria in their gut, and all of the good stuff that they had from your body is just going to soak into their skin and they'll get every little bit of it. Wait 24 hours, wait a week if you want. Remember, babies are not dirty, okay? They were in their perfect human biological stew, and that is exactly the kind of stuff that they need. And also remember that bathing doesn't have to be dunked in the bath and completely submerged and all that stuff. Bathing your baby can be using a wet, warm washcloth to bathe their, private area where poop and pee is going on. So just keep that in mind and stay, flexible and do whatever you feel most comfortable with. I also have some fun tips below for helping your older children, if you have them, adjust to the new baby, and some of the things you can do before birth and some of the things you can do after birth. But just keep in mind that it's an adjustment for them too, as I'm sure you already are. All right, I'm going to show you some postpartum exercises that can help your hips as they get back into post-baby position and all that kind of stuff, just to help give you some way to stay mobile and active after you've had your baby. Remember that these exercises are for vaginal birth and might be different if you've had a C-section. Discuss with your provider if any concerns about your activity level are risen. So only do these with the approval of a doctor. Now, the first one is going to have you lie flat on your back. It is an option to have baby on your chest while you do this one. You're not going to be rolling around or anything. What you're doing is you're going to inhale, and as you exhale, roll your hips outward. So basically imagine your tailbone pointing towards your feet, and lift up. And then go back down. And this is a good way to bring some mobility into your hips. Another variation of that, and remember for either one, make sure your feet are staying flat on the floor, is to place your hands under your low back and to press into the ground with your feet and your back at the same time. And this again is getting that nice forward and backward motion in your hips. I know it's hard to see, sorry. It may not feel like much, but any little movement is helpful. This next one is semi-upright. So what you're gonna do is you're gonna, again, plant your feet on the floor, put your hands across your chest, and I want you to lean back. Your feet are gonna slightly push forward and back. Forward, or backwards and forwards. I got all mixed up. All right, so for this next one, you're gonna start out laying on your back. Put your right hand behind your head, and I want you to curl into the opposite knee. And then switch and do it the other way. How many of these you do is up to you, and I don't recommend doing them until at least 2 weeks after you've had your baby. This is your time to relax and enjoy this time, okay? And I don't recommend you getting exhausted because you're also getting used to a new sleep schedule and all the extra tasks that you have to do. So only do these as an extra benefit, as an extra way to relax, and as an extra way to feel positive about your body. This next one is a fun one to do with your baby. Rest them on your knees and then lift up your butt and let your shoulders rest into the floor. This is a great way to have mobility in your hips and exercise your core muscles, and it's a fun little ride for baby. And any other kids that you might have laying around. I know that it can be extra hard for moms with multiple kids, but keep in mind they probably want to lay on the floor and do the exercises with you. I know mine always do. This one is a rocking motion exercise. So I want you to fall back and then pull yourself forward. This one is very low impact, but it just encourages mobility in your spine and is activity. Keep in mind that any yoga poses you found helpful during pregnancy, for instance, cat and cow is a super popular one, is still going to be beneficial now as your spine gets back into regular positions. And make sure you're incorporating a lot of breathing, deep inhaling and deep exhaling as you go. Keep in mind that there are just as many yoga postpartum videos out there as there are yoga pregnancy videos. Explore and find something that you like, and don't make it about losing weight or getting your pre-baby body back. Make it about feeling better and having more energy throughout the day. Thanks for watching. All right, that's it for this video. See you in the next one.